Hello, and thank you for allowing me to address an audience of innovators and leaders in Pittsburgh's healthcare community. First, I want to extend my personal appreciation to Kaz Welsh, a published author, respected professional, and a constituent. He's organized a terrific conference befitting of an organization that values quality in all that it does. Thank you, Kaz. Now more than ever, the skills and ideas coming from people like you are needed to truly reform the way that doctors, administrators, and healthcare professionals think about and practice medicine. The new healthcare law makes substantial changes to the relationship between doctors and patients, but one thing that it does not do is eliminate the nearly $1 trillion lost each year to waste and inefficiencies in the $2.5 trillion American healthcare system. Without quality reform, there is no real healthcare reform. Now, there are some unique ideas in the legislation, but it will not achieve true healthcare reform and lower costs. Just last week, the administration's healthcare actuary concluded that the new law will increase national spending on medical care by $311 billion with no discernible improvement in outcomes. In fact, it will likely make it harder for senior citizens to find a physician willing to accept Medicare. Now, having treated thousands of patients over the years, I saw firsthand how the inefficiencies and inadequacies of the current system bankrupts families and denies patients needed care. It was because of my experience as a healthcare provider that I entered public service with one overriding goal: to have a meaningful impact on reforming our healthcare system. It was a personal and a professional disappointment for me that I could not support the legislation, because I'm in Congress to find solutions to reform the healthcare system. Nonetheless, I look at passage of the new law as only the end of the beginning. Today, we begin on bringing the forces of quality and reform to bear on an inefficient, wasteful system. So allow me to share with you several true reforms of medicine that Congress should pursue in its effort to bring quality, affordable care to all Americans. First, we must address problems with existing government-run healthcare programs. Medicare was written at a time, 1965, when the most sophisticated equipment in a hospital was an X-ray machine on wheels. Medicare today is a convoluted patchwork of laws reflecting decades of ad hoc changes that do not always meet the needs of the patient. It is not a system focused on health outcomes, but one focused on paying for procedures. Medicare payment models must be reformed to reward efficient, integrated, evidence-based medicine that delivers the best care at the best price. I'm working with colleagues to form a blue ribbon panel of medical professionals to make top-to-bottom recommendations on fixing Medicare and Medicaid. Second, Congress must promote evidence-based medicine, especially for Medicare and Medicaid. There is between $600 and $800 billion wasted on unexplained geographic disparities in treatments and procedures. Fortunately, the standards and protocols of clinical excellence already exist to eliminate this waste. The specialty academies and colleges of medicine publish treatment guidelines that are based on peer-reviewed scientific literature. With standards in place, doctors can reference the best care and tailor the treatment to the unique needs of the patient. If Medicare and Medicaid paid doctors and hospitals do what is best to prevent and treat heart disease, lung disease, or diabetes, for example, rather than pay for each procedure, we would be well on the way to reforming the system. Third, former Supreme Court Justice Louis Brandeis called sunshine the best disinfectant. Well, increased sunshine or transparency leads to improvements in quality. Most notably, in today's healthcare system, sunshine is needed for hospital-acquired infections, which cost $50 billion and 100,000 lives each year. More people die from healthcare-acquired infections than from breast cancer or automobile accidents. I've introduced H.R. 3104, the Healthy Hospitals Act, to require hospitals and ambulatory surgical centers to report data on their infection rates. The public could review, compare, and ultimately bring the market to bear on reducing infections and associated costs. The savings would be dramatic. The average hospital charge for patients with a hospital-acquired infection, for example, is greater than $155,000 more than for a patient without. Similar transparency could also be established in several other areas of quality. Finally, the medical community must integrate care between the mind and the body. When a person with a chronic illness such as heart disease has untreated depression, the cost of care doubles. Unfortunately, recent federal investments in health IT do not extend to providers of mental health care. Delivering health IT to mental and behavioral providers bridges the care for those with mental and physical illnesses. For practitioners and patients, HIT is the virtual integration of care. To best diagnose and treat patients, mental health professionals need complete, up-to-date medical histories. Electronic medical records can ensure that physicians and mental health professionals are working together and delivering the best possible coordinated treatments. I'm co-sponsoring legislation, H.R. 5040, with Congressman Patrick Kennedy of Rhode Island, to extend federal HIT investments and opportunities to the mental health community of providers. Sound health IT reforms are the catalyst towards interoperable, interactive, integrated, and intelligent healthcare. Quality healthcare reform means innovation in medicine, preventive care, and collaborative care for both chronic physical illnesses and mental illness. I appreciate that those gathered here today are committed to making our healthcare system work more efficiently, effectively, and economically. I look forward to continuing our work together on improving the quality of care and lowering healthcare costs. I encourage all of you to stay involved in truly reforming our healthcare system on all levels so that together we will achieve these goals. Thank you.